Good morning, everyone, and thank you for joining us today. Today's session, entitled Retirement and Life Care Planning, Helping You Build a Path to a Peaceful Future, is being hosted today by Counselor Buchanan and Mitchell, a Washington, D.C. area accounting and advisory firm, the firm's financial advisory subsidiary, MBI, and Paladin Life Care. During this one-hour session, we will be hearing from Judy Barnhard, Alex Seleznev, and Alice Paxton. Judy is the Senior Vice President at CBM. She's co-chair of the firm's financial planning practice and committee chair for the firm's professional service practice. She's also a senior advisor with MBI. In her role as a financial planner, she consults on retirement planning, cash flow and budgeting, risk management, and she provides portfolio review and investment counseling. She's a certified public accountant, a certified financial planner, and a certified divorce financial analyst. Alice Paxton is the owner and managing director of Paladin Life Care, which provides medical and financial advisory for seniors and people with disabilities of all ages. Paladin partners with professionals and loved ones to help clients live independently with dignity and have attentive family-like care so they can live their best life now. Alice holds 3 industry distinctions as a national certified guardian, a certified senior advisor retired, and program management professional. Alex is a senior advisor and a portfolio strategist at CBM and the firm's financial advisory subsidiary, MBI. He is a certified financial planner and a chartered financial analyst who leads the firm's investment management division. Alex's focus is on comprehensive financial planning and investment management. He is also a regular co-presenter at the firm's market update sessions, which are held every other month. As a courtesy to our presenters, please keep your video and your microphone off. The presenters have a lot of content, so they will be focusing on going through all the slides, though all questions have been submitted to the presenters if you submitted them during registration. Please do use the chat feature to submit additional questions that will be held until the end of the session. Again, the session is being recorded and the slides will be made available to you after today's presentation. If we don't have a chance to follow up with any questions, please follow up with our presenters after today's session. Thanks, and I'm going to be turning this over now to our presenters.
Good morning, everyone. Thanks for joining us today. We're thrilled to have Alice Paxton here with the Paladin Life Care to join Alex and myself today. We have a lot of information to cover. Here are the topics. We're going to be retirement planning, investment planning, insurance, some income tax concepts, budgeting and cash flow, and then Alice will be talking about life care considerations. With that, Alex is going to lead off.
Thank you, Judy. Thank you. And again, thank you everyone for joining us today. So we'll start with your overall retirement or financial plan. So we, as you can imagine, we strongly believe that everyone should have a plan in place or a roadmap. That's how some people refer to it. It can be simple, it can be complex, it can fit on a single sheet of paper. In many cases, of course, it's much more complex than that, but everyone should have a plan. If you currently do not have one, well, what I'm about to say will be quite important for you. But if you do have one, well, how secure is it? So the answer to that question really depends on how clearly you can understand your income and expenses in retirement. Now, there are many rules of thumb that we actually use for discussion purposes with our clients, and perhaps one of the most popular one is the 4% rule. And the idea behind it, let's say you're 65-year-old and you're thinking about retirement, you have $1 million portfolio, and you're trying to figure out, well, how much of this portfolio can I spend each year and not run out of money over the next 30 years. So you would apply this rule, the 4% rule, and that would give you, $40,000 per year adjusted for inflation, and then presumably you would not run out of money for the next 30 years. There are lots of practical issues with this approach. One of them is your specific tax situation. As you can imagine, someone who is in the lower tax bracket would be able to spend more money compared to someone who is in the higher tax bracket if you're just applying this formula. Plus, of course, one of the things I like to say, in the years such as 2020, and we'll talk about that more a little later, would you actually be comfortable with applying that rule to your actual distributions? Now, there are other, conventional wisdoms. That's how I would refer to them. And that's when people come up with an arbitrary number, essentially, in terms of what they would need to comfortably retire. So, $1 million is a very common one. Now, in terms of your lifestyle, and I'm working with the assumption that many of the participants today are in the DMV area, but if you compare that to a place such as North Carolina, well, that would, of course, be a very different lifestyle. So your plan needs to really focus on your lifestyle. In terms of your investments, there's another rule of thumb that is literally based on nothing, but people tend to use it quite frequently, even when they have conversations with us. And the idea behind it, you take 100, you subtract your age from 100. Let's say you're 60 years old, that leaves 40. And that is presumably how much you would have in stocks. And it's literally not based on anything else. Now, if you decide to apply this approach to your portfolio, well, in the years such as 2020 and perhaps even going forward, 60% of your portfolio would essentially be earning almost nothing, maybe less than 2%, maybe even less than 1%. So you have to be careful. Now, a much better way of approaching this is to run a retirement projection that is based on your specific circumstances. Again, your specific circumstances. Now, it would consider all of your income sources. It would consider how much you're planning on saving over the next, 10, 15 years. It would, of course, take into consideration your tax situation, which is extremely important in the planning process. There are two ways of doing this. There are more than two, but these are the main ones. There's a so-called top-down approach. That's one would start with everything you have as of today, would make some assumptions in terms of your rate of return, your savings, your social security, your pension, and then would figure out how much you would have, let's say, from your age 65 to age 95. Would, of course, tax affect it and then compare to your lifestyle. A different way of doing it is when you essentially say, look, Alex, I would like to maintain a lifestyle of, $7,000 per month. What needs to happen over the next, X number of years to accomplish that? Usually would run it actually both ways. Now, once we develop the scenario or multiple scenarios, we must stress test them. And I don't really have to go far to, to give you the reasons why. Just in March of this year, most of you, or all of you know, we had one of the, historic corrections or market drops of more than 30%. So we need to be prepared for that. And that needs to be one of the scenarios that we at least discuss. And we certainly need to be prepared for that. And we'll talk about option of how to do it. Now, as part of the planning process on our end, we always plan for longevity, or to say differently, for so-called longevity risk. So according to Social Security, if you're 65 years old today, you're expected to live on average to approximately age 86. Females are expected to outlive males by a few years. Now, according to Boston Consulting Group, and I happen to agree entirely with that finding, close to half, or 43%, of retirees underestimate their longevity by at least 5 years. In some cases, actually much more than 5. And that may have, perhaps will have, very significant effect, negative effect on your planning. So if you look at one example here, let's say someone is 65 years old today, wants to maintain a lifestyle of $100,000 in retirement. If we're planning to age 85, this person needs, $1,588,000 again to maintain this lifestyle. If we adjust it to age 95, which is, by the way, our normal approach, we've been doing this for several years, more than 10 years actually at this point, due to age 95, that figure is now more than $2 million. It's a difference in this example of more than close to 472,000. Every so often, we'd even run it to age 100 and see what happens. Again, the bottom line is your plan needs to be adjusted based on your life expectancy. All right, once you have a plan in place, a financial plan, usually the next step is to ensure that it matches your investment portfolio. So what are some of the key ideas here? Well, your asset allocation. There are lots and lots of studies on the subject. They come out almost every year now, big studies that are saying that up to 90% of your long-term performance results are really affected by your overall asset allocation. essentially the split between your stocks and bonds. Not by how well you time the market, not by how well you pick your individual stocks or funds, but your asset allocation. So that is key. We'll go in detail on that in just a moment. Diversification, and hopefully, most of you or many of you are familiar with the concept of not putting all of your eggs in one basket. But in practice, when we review our clients' portfolios, that is not always the case. What happens frequently, you have multiple accounts, you have multiple funds, 10, 15, sometimes 20 different funds, but under the hood, they're essentially the same. They're either too income-oriented or too growth-oriented, and they tend to perform very similarly. So there is really not much diversification. The idea of considering your risk appetite in the context of your expected longevity, something I touched on a moment ago. Many people in their pre and post-retirement years, they tend to be more risk averse, which is perfectly understandable. Certainly not everyone, but in general, it's a good observation. Now, if you decide to take very little risk when it comes to your investments in the beginning, you're essentially increasing your chances of outliving your money in your retirement. Essentially, you're increasing your longevity risk. So it needs to be a balancing act. And of course, your age and your inheritance considerations, they're important factors if you want or if you need to leave a significant chunk of your assets to the next generation. That needs to be part of the plan. The most important idea that we always discuss with our clients, again, who are in their pre and post retirement years, do they have enough in liquid investments to cover their spending for at least 7 years? What is so special about this 7-year figure? Well, this is on average how long it takes for the markets to recover. 2020 in some sense doesn't count. It's a very strange year, but on average, this is how long it would take, and we want you to be fully covered. Now, when we structure our portfolios and when we develop our projections, we have to base them on something. So what you're looking at here, this are your four, say models. I would put them that way: your conservative, your balanced, your growth, and your aggressive growth models. If you look at the returns, well, the conservative portfolio that consists of 20% stocks and 80% bonds return close to 6% over the past 93 years. And by the way, it would be very similar if we fast forward to today. Now, the most aggressive portfolio here returned more than 9.5%, essentially 85% stocks and 15% bonds. I have a couple observations here. There's a lot to be discussed, but really two important observations. If you compare the aggressive growth and the growth allocation, the aggressive growth is essentially 2 times more risky because it has only 15% in bonds versus 30% in bonds for the growth allocation. But the performance, even in the past, hasn't been significantly different. So that's my first observation. Now, the other one, if you look at the conservative portfolio that returns 6% over the past 93 years, given where we are with interest rates at this point, historically low interest rates, what are the chances that a portfolio that consists of 80% bonds will return 6% going forward? So when we're planning, we have to take that into consideration. Next slide, please. So this is actually one of my favorite slides. We talk about it quite a bit in our investment webinar, so I'll go over this quickly. What you're looking at, this is asset class returns QUILT, and it shows you the performance of each asset class, of each major asset class by year and year to date. Now, year to date, large cap domestic stocks in blue, they are the best performance. Balanced portfolios have been doing reasonably well, meaning a split of 50% between stocks and bonds. Domestic bonds, because again, interest rates went down, there's an inverse relationship between interest rates and bond prices, are up more than 6% for the year. Cash is essentially flat. Mid-cap domestic, small-cap domestic, and international developed markets are in the negative. Emerging markets are perhaps the most interesting category if you look at the global markets. They're in a negative for the year as a group, but Chinese markets specifically, perhaps of how well they tackle the coronavirus situation, they're actually up more than 12% for the year. Commodities as a group are in the negative, more than 10%. That's a basket of commodities, oil, soybean, other commodities. Gold is up. You don't see it on this chart, but it's one of those fear assets that tends to perform well in times of market volatility. And then real estate, I would say, shouldn't be surprising to most people, is the worst performing. Bottom line is, if you look at this chart, if you look at the scholars, look how differently each asset class performs each year. That is, again, the benefit of diversification, because you really never know how things will do. Judy?
Yeah, so I see we have one participant who's raised their hand. We will try to take questions at the end, but we have a lot of information to cover today. But I did want to just note, I do see the hand raised. Okay, so we've talked about longevity risk and market risk. Now we're really going to try to talk about, expenses, budgeting, debt, and how to minimize your income taxes, because of course that all plays into how much ultimately funds you will have for retirement. The CARES Act presents a unique opportunity for the year 2020 because the required minimum distributions for IRAs was suspended. And so a lot of individuals in retirement have basically an allowance where they don't have to take that RMD. In addition, the date that you have to start taking your RMD was extended to age 72 from age 70 and a half. So that creates a 2-year period where your income could be lower than what it had to be because of that required distribution for IRAs. So what does that mean? We think it presents a unique opportunity to perhaps do a Roth conversion, that is converting IRAs to Roths, which we'll be going over in a minute. And it's also an activity where this year in March, when the market went down 30%, to harvest losses so that you have, in essence, a stash of harvested capital losses that can be used to offset capital gains, both in your income tax returns this year and in the future, depending on how much of a capital loss you were able to lock in. So we also recommend you be strategic about timing, short-term, long-term sales of assets. That we're specifically talking about the capital gains. We will talk about monitoring income tax thresholds. I have a slide on that. And of course, being aware that there are preferred tax items such as municipal bonds, the fact that capital gains and dividends are taxed at a lower rate than ordinary income. And then in terms of decisions for where to retire, there are currently 9 states that have no income tax. The most popular ones, I guess, in the East Coast, Midwest would be, Texas and Florida. But that's a big decision. There's also many states that don't tax pensions. So, where you end up retiring can have a big impact on the amount of income tax that you end up paying. And in terms of estate and gift tax, there's 33 states that do not have an estate tax. And there's some overlaps. So there's states that don't have the income tax and also don't have the estate tax. So those are states that, if you really want to try to conserve your taxes, those would be states to look into. And of course, lower cost of living. Mississippi has the lowest. Hawaii has the highest. You can Google if you were interested in what the cost of living is in various states as well as cities, because there's a lot of current information out there. Also want to just add that when we talk about the opportunity to convert to Roths in 2020, Roths are a lot more popular today because in the Secure Act, when you leave an inherited IRA to a beneficiary, that stretch IRA to be able to have the beneficiary take the income over their lifetime has been reduced to 10 years for non-spousal beneficiaries. So it's no longer as popular, and where the Roths are inherited tax-free. So it's definitely something to consider, and we'd be happy to talk to you about that. With regard to IRAs in retirement, we do recommend you have a mix of non-taxable and taxable accounts. Of course, non-taxable would be Roth. This is so that when you decide which bucket of money to take money for when you're retiring, that helps you to manage what your actual tax bracket is. If you're still employed, you can still contribute to an IRA. And again, the Secure Act remove that age limit. You still have to have the earned income associated with it, but it is an opportunity for you to be able to contribute to IRAs, even if they are tax deferred, which we refer to as the non-deductible IRAs. It's a way of being able to put money away, tax deferred, and not generating current taxable income through interest and dividends and so forth. And then, of course, if you have grandchildren or children that have earned income, you might set up a little nest egg for them by contributing to a Roth, which they may also have a saver's credit that they could take advantage of. And here's just a quick example that, you know, if you funded $5,000 for a child's Roth over 50 years at an 8% return, they'd have a future value of $234,000 just from that one gift that you were able to make. Okay, in terms of tax bracket and planning, I'll get to that in the next slide. Health savings accounts, if you have a high deductible insurance plan that allows for health savings accounts, definitely recommend that you contribute to them. There's $7,100 is allowed in 2020 for a family plan, plus another $1,000 if you are over age 55. These health savings accounts are a use or lose role year, and they can be invested, and you can basically use them to help offset medical expenses in the future when you're in retirement. So they're definitely something to be funded as much as you're able to do so. Tax efficient investing, you know, that's basically talking about, you know, where do you actually hold your assets? Do you hold them in your retirement plans that come out being taxed at ordinary income rates, or do you hold them in your brokerage accounts that come out more as interest and capital gains? And that it requires someone like Alex to really help you, you know, sort out what is the right balance and still having the proper asset allocation, but having those assets held in the right type of account. It can make a big difference on what your actual income tax obligation is. Qualified charitable distributions, once we are required to take our required minimum distributions, you can donate directly from that IRA to a qualified charity, and that saves basically having to declare that IRA at ordinary income tax rates. So it is a good vehicle for meeting your charitable donation requirements, even if you take the standard deduction. So something to think about. Donor advised funds. Best example of this is to be able to donate appreciated stock. And as we do have the higher standard deductions now, and many people are not able to take advantage of charitable giving as an itemized deduction, they may want to, in a high tax year, make a donor advised fund and then use that fund to meet their charitable giving requirements in the future. So that's something that's just, you know, tax smart to the extent that you're able to do that. Of course, you know, income taxes is an expense, and we want to try to minimize that. You know, to the extent that you have less money to grow, it's less money for your retirement. So that's why we spend a lot of time trying to minimize this. Okay, love this list chart. This is the tax bracket game. There are actually 7 tax brackets going from 10% to 37%. But what this slide shows is all the way in the far right column where it says long-term gains and dividend rates. If you notice, it says 0%. And then there's a highlighted box under married filing jointly of $80,250. There's also one $40,125 for individual and $53,700 for head of household. That means that as long as your taxable income is not over that amount, you pay zero tax on your long-term capital gains and dividends. So this is called playing the tax bracket game. And in addition to just being able to have your investment income not taxed, you can also try to manage through, as I mentioned, using different buckets, if you will, when you're taking money out for your retirement, that you manage your taxable income so that you stay within the lower marginal rate brackets of the 10, 12% ideally, if you can. Now, we had some questions in advance of this presentation about what will change. Should we have a Biden administration? Biden does propose to revert to the highest tax bracket of 39.6 from the current highest of 37. That 37% was put into law with the Jobs Growth and Tax Cut Act that was implemented in 2017. And it actually sunsets after 2025. So basically, under a Biden administration, they would push that sunset up and revert back to the highest bracket of 39.6%. In addition, he has proposed taxing capital gains and qualified dividends at the 39.6 rate for those earning over $1 million a year. Back to you, Alex.
All right. Thank you, Judy. So long-term care insurance, or LTC insurance, this is perhaps one of the hottest topics over the past several years, and why some of the clients reach out to us in the first place. So in terms of the basics, well, it helps you preserve your assets by providing the benefits to cover the cost of your long-term care services if you ever need them. Now, under most policies, the benefits would be provided if you're not able to perform any two activities of daily living, or ADLs, and they're listed on this slide. That's one of the things I always mention. If you're not able to walk, unfortunately, under most policies, you would not be receiving those benefits, or there would be some kind of partial benefit. Now, the way it works, they reimburse for your expenses. So you still pay out of pocket, and then you submit your invoices to the insurance company, and then they reimburse you. That, by the way, creates a lot of issues. One of the immediate issues is many policies come with a waiting period or elimination period. It can be as high as 180 days. So essentially, the policy would not be paying anything for 180 days. Not to be morbid here, but for some of our clients, essentially by the time it expired, they were no longer with us. So that's one of the concerns here. In terms of the characteristics, every policy will have the ones you see on the bottom. The premium, of course, the premium payments, they keep going up at a significantly higher rate than the rate of inflation. You'll have your waiting period, maximum daily benefit, the payment period. None of the policies these days are lifetime, so they'll cap you at 5, 7 years, potentially as low as 3 years. There's a maximum lifetime benefit. It will not pay more than this predefined amount. And of course, there's a cost of living or COLA adjustment. And if you pick it, well, your premium will be higher. Next slide, please. So in terms of the costs, and what you're seeing on this slide, as provided by Genworth, one of the companies, long-term care insurance companies, these are the costs for different types of care in our area, in the Washington, D.C. area. So if you look in the bottom right here, if you need to go to a semi-private room in a nursing home, it would cost you more than $137,000 per year on average. So it can be higher, it can be lower. So that is more than $11,000 per month. So it goes without saying, it's a very expensive type of service. And then, of course, you can see look at other options on the slide. Now, in terms of how long people would need it on average, it's actually 29 months. So for females, it's 3.7 years. For males, it's less, it's 2.2 years. So the key questions here when we discuss these questions with our clients, well, how will you pay for it, assuming that you want to plan for this type of expenses? And would it be possible for you to self-insure? So both of these questions are addressed as part of the planning process. If you can envision a scenario where, again, we already understand your income, we understand your expenses, so we create a scenario where you need this type of care. In terms of your budget, which is something Judy will touch on a little later, well, a lot of your budgeted dollars are now redirected toward care. You're no longer traveling. You're no longer buying cars, perhaps not buying that much clothes. So it's all on spend on medical care. A lot of those expenses are tax deductible. So in many cases, your taxes would be significantly less, again, if you find yourself in this situation. Now, if as part of the process we determine that you do need this type of care, the best age to apply is between 48 and 54. That is the best age to apply from the cost benefit perspective. For many people who wait beyond their mid 60s, perhaps early 70s, it becomes prohibitively expensive. Not for everyone, but for many. One of the quotes, one of our clients received earlier this year for, I would call it basic coverage. It was close to $800 per month. Again, for a benefit that you may essentially never use. So again, the answer is, do I need this type of care, or perhaps I can self-insure, is frequently addressed as part of the process. Slide. Whole life insurance. So when we talk about looking at what options are available to you, in some cases, whole life insurance is one of those assets that can really help improve your overall financial plan. So some basics here: these types of policies are meant to be there for your lifetime. The premiums are expected to stay the same over your lifetime. And then as a portion of each of your premium payments is essentially added to the cash value, so that over time the cash value of your policy increases. And of course, the death benefit is guaranteed as long as you continue making those premium payments. So in terms of planning, this is an actual example how we work with one of our clients. We, of course, changed his name. So Mark here, he bought a whole life policy when he was in his 30s. Over time, of course, he kept making those premium payments. The cash value increased all the way to $180. That is when he reached out to us. He has a choice now. He can continue to make those payments, and then, his estate or his beneficiaries, they would receive the death benefit, or he can cancel the policy, which actually accomplishes two goals. It improves his cash flow, so the premium payments that he is no longer paying can be used for something else, and the $180,000 can be used for his lifestyle or for his expenses, or potentially to cover at least a portion of his long-term care expenses, is that if they were talking about this in that context. The kicker here is that in many cases, this surrender would be partially tax-free, or in some cases, 100% tax-free, but you really need to check with the provider on that. So the bottom line is, if you have a policy like that, it should be included as part of your overall plan.
Okay, next thing we're going to talk about is, the question is, should you be carrying debt into retirement? And I think if you have a room full of certified financial planners, you'll get different answers from different planners. The takeaway is really will you have enough funds to be able to meet your obligations to provide the lifestyle that you want through day to day? Able to take the funds that you would otherwise use to pay down that loan and invest it and earn more, then certainly there's the argument that overall is good advice. However, I tend to be part of the one side of the room that would say, to the extent that you can get that that monkey off your back, you're going to be better off, because then you have less funds that you need basically to meet your obligations. And this is just a very simple example that, if you have $1 million nest egg and you're age 67 and you're planning on, you're planning funding to live to age 85, if you have debt versus don't have debt, it could basically show that your annual income is reduced from 70,000 to 57,000. So it's certainly something to be factored in as you near retirement. This is another example of time value of money. If you're able to refinance, and of course interest rates are really at historical lows, if you're able to refinance and or just pay the next month's payment in advance and shorten the number of payments left that you have on your mortgage from a 30-year to 15-year mortgage, you could save, in this example, $223,000 in interest paid. Spending habits. This is from NerdWallet. This is an example of how retirement age persons are actually spending their money. And you can see, obviously, housing and transportation and healthcare are going to be your biggest, and food. And so what we recommend is that you make a budget, and you make a budget of what all your current expenses are. And then you have an adjustment column as shown here, and you adjust that up or down for what you think your actual costs will be in retirement. And you tally that up for a month and multiply it times 12, so you have it for the year. You say, okay, I'm going to be spending $72,000 a year in today's dollars in retirement. I have income from pensions or Social Security, that'll cover $22,000. So I need to basically be funding $50,000 a year from my saved investments. And you take that and divide it by your portfolio value of $1 million, and that shows an annual distribution rate of 5%. This is just one way that you at home can go through and do a rough estimate and see whether or not you're in the ballpark. When we work with clients, we do full blown out budgeting and then also retirement projections and different scenarios, as Alex mentioned, not just should the market drop 30%, but what if I move to Texas, or what if I have a second home, or whatever the what if is. We can run different scenarios so that we can meet the needs of our clients' goals, which is really ultimately what we're trying to do here, is to make sure that when you retire, you are meeting the goals that you've set out to in advance. So with that, turning over to Alex. Alice, you're muted.
Thank you. Hi, everyone. It's nice to be here today. That was a great presentation given by Alex and Judy, and it does, I think, very definitely point to working with a financial advisor for your future, as well as incorporating a life care manager into your planning for your future. Next slide, please. So what's life care management, and when do you need it? That depends obviously on your health. When do you need it? It depends. You'll be working with your financial advisor, and they'll be advised of the time to come to this decision. But the important thing is that to have a life care manager who's going to help you create a plan. There may be nothing wrong with you now and you just want a baseline. That's suggested to have a baseline health care plan, and then to check in yearly. Everything's fine, good to go. If things occur, you have a partner on your side to help you manage it. The important thing is that a life care manager is going to help you with that plan. This slide shows the various areas that Judy and Alex have covered in their presentation and things you want to consider of going forward. This is what a life care manager will help you when your financial advisor helps you work up your budget for your retirement, to help you stay within those parameters, as well as giving more of a heads up what's happening. Has the diagnosis changed? Is there a diagnosis could be positive as well as negative. And this plan that a life care planner will help you put together concerning your medical, your emotional well-being, your housing, your residence. You saw how expensive healthcare is going to be. We need to take that into consideration. You need to work with a life care planner that'll help you decide, do I want to age in place? It's called, so stay at home. What adjustments do you need to make to your residence so you can stay at home if you become ill? If you are comfortable with the thought of going to an assisted living facility, then that is also working with your financial planner. What is that cost going to be in the coming months? How do you do it? How do you transition that? Next slide, please. So we've talked about the essentials of life care planning. We've had, we talked of COVID at the moment. So many people have started to us as life care managers to get a plan in place. What if? There's a lot of what if scenarios going along so that you are prepared for the future, not only for yourself, for your spouse, for your other loved ones, or what if you have a special needs child? How are you planning to care for them with unforeseen medical expenses? You know, nobody expects to get dementia, nobody expects to have a stroke, and it's really hard to imagine the medical supplies that would be needed to help you in the event of an unexpected illness. And a care manager is going to help you adjust to those unforeseen medical expenses in working with your financial advisor. Next slide. So who are really life care managers? Well, typically they're nurses, gerontologists, they are social workers, but the point is most, if not all of them, have special training and other degrees. And so they have degrees, they have letters after their names, and they have experience. They know the resources in your community. They know the good and bad in-home care facilities. They know the good and bad assisted living facilities. They know who to reach out to that works for you. So if you have a life care manager, they're going to become your new best friend, and they're going to help you make these decisions much easier. Also, a life care manager having other credentials are all bounded by a code of ethics and standards of practice. And this is so important nowadays because we have financial abuse going on. We have physical abuse going on of our seniors, also people with mental disabilities. And a life care manager, you can be almost assured that they will take care of you or your loved one to the quality that you expect them to be cared for. We have, for instance, I'm a national certified guardian, and I have to have CEUs, continuing education units, every 2 years to maintain my license. So part of our ethics is putting the best care of our client first, and always considering what are their desires as opposed to what I think is good, as opposed to what the family thinks is good. What have I learned from my client, how they want to spend the rest of their life, and make sure that is in the plan. Next one. So here you go. We work with our families in many scenarios. And you may have, like the beginning, do you have a loved one whose memory, they have memory loss, or you're suspicioning it? They're refusing help. Independence is so important with our seniors. It's hard to envision ever being a time when you cannot drive or someone is not allowing you to drive. It's hard to envision how would you be affected if you have a stroke. it's, you know, if you're confused by these options, it's a life care manager who's going to have the answers for you and create a plan that is going to take all these things into consideration. It helps, it's really in difficult times, a life care manager helps you be a family again, because they know the answers to the questions you don't know. They know the questions to ask. They know the community resources around that they can get for you. They will work with you in making this plan and making it a livable plan, so it adjusts as your healthcare needs just adjust as well. You know, in making a decision when there's family conflict, I have often I will come up with a strategy, a plan of care for a parent, and I said, well, Alice, that's great. I think that's how we should move forward. And 9 times out of 10, the son or the daughter is saying, you know, I just told my father that last week and he disagreed. You have to realize that child's always a child, and sometimes with a third person coming in, they'll agree to it, as opposed to you saying the same thing. You're still the child in the parent's eyes. Next slide, please. So, what are the responsibilities when you have a life care manager create a strategic life care plan for you? You are hiring a professional. They know how to assess the individual needs. They know each client is different. No care plans are alike. It is going to help you if you do have family conflict. The third person has an objective eye. Monitoring the clients. This is monitoring, or might say oversight. They are going to provide oversight if you're at home, oversight if you're in the hospital, oversight if you're in a assisted living facility, so that you can rest assured that somebody is there to advocate for you in any condition to make sure that you are able to live your best life now. The life care manager coordinates care. They are the quarterback, if you will. They are the one person who knows all your doctors, who knows all your special resource, who's your lawyer, who's your financial advisor, so that communication is always on top. The family knows what's happening, your wealth advisor knows what's happening, your attorney knows what is happening, and that's you are getting your best well-rounded care with everybody knowing. And so it moves like a well-oiled machine. Go ahead, next slide. So in my experience, here are some of the quotes that kind of resonate. You know, I've had many clients have, you might call it a fender bender, a side swipe with a car, you know, and the client, well, it wasn't so bad. Well, you know, maybe it is time to take the keys away. Life care manager can help you with that decision with your parent. I had the COVID-19. I have a client who, before we were able to get her into assisted living, she was in her home and she was a wanderer. So she would wander. And this was before we were able to get her in-home care companion. She, you know, and I would say, it's dangerous out there. There's a new flu, it's called COVID-19. You need to stay in your house to be protected and safe. And she goes, but I'm in my house, perfectly safe. You know, these, you know, kind of quotes like this that may be your clue that there's something going on that you need help with. Again, when a life care manager comes in and becomes a part of your team, the first thing they do is an assessment for your loved one. Next page, please. So the assessment is going to be holistic, or it should be, and you should question it if it's not. You want to be able to coordinate all the services, someone who can coordinate all the services that are needed, someone who can advocate, going counterclass with the doctors, with the hospital, that someone who can understand your financial, maybe not know all of it, but work with your financial advisor to help you get bill pay so your bills are being paid. A third party, an important part which happens to distinguish ours, is we do serve as a fiduciary. So if a client should need a third party guardian, we can handle that role. If they should need a power of attorney, we can handle that role, as well as be a trustee for trusts or special needs trusts. And they look at all these factors. It's included in the plan, and their ethics, I can promise you, make sure it is all fulfilled. So you have peace of mind in that. And here are some of the bullet points that a good plan would include. I think most importantly for me is the short term and long term. That for the short term, what's immediately needed, we plan from 1 to 3 months. What can we get done right now that has to be done? Then has the long-term plan. So I usually give the suggestion of short-term plan. We assess a client and see that they need a wheelchair. Well, we can get a wheelchair in 2 days. But then the long-term part of the plan is building a ramp to the front door, making transportation arrangements. Do we need to adjust the kitchen? Do we need to adjust the bathroom situation? All those different things take time, and that's part of your long-term plan. But it also, you want to be sure that the plan not only identifies what needs to be done, but includes a plan. How will this be carried out? Next slide. So questions that you might consider, and these are questions to work with your financial advisor with, but think, it's usually a couple who is going to take care of each other, but one of you comes ill. I take the scenario, couple caring for each other. He needs a knee replacement and is in the hospital, comes home to, recover. And then the wife gets the flu and she's sick. So a life care planner can help you bring in a home care helper at the time, and you get your chicken soup and your sheets changed and you're both taken care of. In 2 weeks, the wife is better. Everybody leaves and you're back to your routine of taking care of each other. So it can be an in and out situation as well. Final slide. Yep. And then I guess this brings Alex.
Yeah, thank you, Alice. Thank you very much. We do have multiple questions, actually. They were submitted to us prior to this webinar, so we'll try to address as many as possible. So here's one. I would like more info on care centers. Some you buy your condo, some you put down a deposit that is substantially returned, some you rent, etc. So I think, Alice, this one is for you. So how should this person approach?
There are various kinds of assisted living. There are what we call CCRCs, which are continuous care retirement communities that you can go into for retirement. And then they add services as needed. If you need assisted living, that's, as Alec talked before about an ADL. If you are unable to do 2 of the ADLs, you would require assisted living. Nursing home facility is when it gets more, etc. Memory care is usually for people with dementia, Parkinson's, those assisted. But I usually recommend for my client not to buy in. I prefer renting rather than buy-in. Buy-in leaves the apartment to your estate, and usually it has to be sold when you die, so that your estate has to deal with that. And it takes up the money that isn't there any longer unless you can sell it.
Thank you, Alice. And there's a quick question from one of the participants on what is ADL? It's an activity of daily living. So again, with long-term care insurance, it pays when you're not able to perform any 2 out of 6. So if you're not able to walk and you're not able, let's say, to eat, there's actually a slide we had on that if you want to check it out. All right, one more question here. Starting from and based on current information of retirement funds and Social Security and anything else necessary that one has invested toward retirement up to date, how can one compute the exact monthly pay on retirement? Judy, so perhaps this one is for you.
Yeah.
Sure. So I'll go back to the budget slide that I went over. You first want to obviously determine what your expenditures are on a monthly basis, annualize that, and then subtract out the fixed income that you do have, the Social Security and any pensions coming in. And then the balance would be the amount that would come from your brokerage account. And so you're going to want to have a plan in advance that's what you're going to spend. And keep in mind that if you spend more in earlier years of retirement, that can be detrimental to your overall retirement plan because you're reducing then your available investments, which, as we've shown in terms of the value of compounding interest, will result eventually in less money being there for you in your later years, which, keep in mind, could be your more expensive years with healthcare. So you have to be disciplined and really be disciplined in terms of setting pre-retirement how much you want to have set aside once you retire, because it's a little late when you retire and this is what you've got. So it's what we try to do is help our clients really determine not just how much that they need when they retirement, but what do they need to do between now and then to get them to that goal.
Thank
So
you, Judy.
Yep.
Thank you. So I guess we have time for one more question. I'm self-employed and my long-term financial security is wrapped in significant real estate properties. Do you recommend short and or long-term disability insurance for somebody getting close to 60, such as an AFLAC or long-term care policy? So there's essentially two questions here. For someone who is 60 years old, it is unlikely that that person needs to have any long-term disability insurance or LTD, not LTC. That type of insurance is very important for, let's just say, younger people, especially in situations when you have a couple, let's say with children, and only one of the parents is working. Essentially, the entire income is tied to that one person. So it's just one example of that. Short-term disability, what's interesting, we rarely recommend that to begin with. We usually suggest that our clients maintain somewhere between 3 to 6 months of their expected expenses in reserves to essentially cover. If you're working for someone, if you're a W-2 employee, many employers would provide that to you. In terms of long-term care policy, which is essentially what we talked about earlier, the answer is it depends. The answer is it depends. You can always get a quote, right, and see what it would look like. You can always shop for policies and see how that fits in your overall financial plan. But one of the questions I would like to evaluate, would it be possible for you to self-insure? How realistic in that? And only then, again, I would start shopping for policies.
Alex, I'm just going to quickly answer. There's a question that came through the chat box. If you're in your 60s and entering retirement, how do you plan to cover and prepare for health care expenses other than long-term care? So I would become familiar with what Medicare covers once you're eligible for Medicare, or if you're a federal employee, if you're planning on staying with your Blue Cross Blue Shield insurance. But become familiar with what the copay costs are. Become familiar with the donut hole where Medicare stops covering. And we can help you. We didn't talk about Social Security in this session because, frankly, we have a whole nother session, which actually I think Alex and I are going to try to do again in January, where we'll talk about Social Security and Medicare. But that's the thing, you need to become aware of what will and will not be covered by the insurance plan that you will have in place at, say, age 65 and beyond. And then, plan on saving enough funds to cover the costs that aren't being covered. And we're happy to help you determine that.
Good.
So with that, upcoming events, next Tuesday, is it next week? No, it must be 2 weeks.
2 weeks from now.
Yeah, Tuesday the 10th, we have an event put on by our outsourced accounting department, and they will be presenting on accounting for your not-for-profit organization. On the 17th, we have creating financial harmony, living together, engaged in newlyweds. This is going to be put on by some of our younger financial planning staff, so we're very excited about that one. It should be fun. And on the 19th, Alex and my partner Debbie May will be putting on the market update, which we now have been holding just about every 2 months. So, and the election will be over by then, we hope. So yeah, tune in on. Also want to tell you, we do have at CBM a coronavirus resource center. It is on our website. There's lots of information there regarding the PPP loans, both how to get them forgiven, and other resource information in terms of income tax planning and so forth. So you can actually put your email in if you want to receive updates from us. And if we have not been able to answer your questions, please feel free to reach out to Alex or Alice or myself. Here are our phone numbers and our email addresses. We thank you very much for attending. We welcome the opportunity to be able to present. Love the virtual seminars because we get a lot more people that are able to attend. So with that, be well, stay safe, and thanks. Have a good day.
Thank you very much.
Bye-bye.
Bye-bye.
Bye-bye.